Type 2 diabetes is on the rise among adults, but is now being diagnosed more frequently in teenagers and young adults, which could soon lead to a public health emergency. But just as alarming as the number of people currently diagnosed with type 2 diabetes are the more than 50 million people who are now thought to have prediabetes.
Everyone who's in that group needs to, number one, know to take care of themselves, needs to know that they have a blood pressure and cholesterol as good as it could be because they're at risk for heart disease, and needs to know what's happening to the blood sugars over time. That if people find themselves earlier and take responsibility earlier, the whole natural history of diabetes may be different.
Type 2 diabetes has both a long and a short-term impact on the person.
The short-term consequences of type 2 diabetes are often psychological. Really being hit by a diagnosis that is a lifelong diagnosis. And there are very few illnesses where it changes how you identify yourself. You say, I am diabetic, rather than I'm a person with diabetes.
The quality of life for a patient with diabetes or a person with diabetes can be altered in many ways. They may not feel well when their blood sugars are elevated because that causes fatigue, it slows them down. It can cause problems with frequent urination where they're in the bathroom often. It can affect them in terms of their mood.
We can try that one.
55-year-old Virgil Williams has been living with type 2 diabetes for 20 years, and his family history is strong.
My great-grandmother, my mother, my dad, they're all deceased now, but they all had diabetes.
Virgil knew he was at risk, but he was shocked when he got the diagnosis.
When I first heard the news, I was just devastated. And I knew it meant a complete life change for me.
The approach that works best is an intensive multi-risk factor interventional plan, which includes tight control of glucose, blood pressure, and cholesterol levels. People with diabetes must also adhere to a regimen of healthy diet and regular routine exercise.
By lowering blood pressure and cholesterol and blood sugar together, we can really dramatically reduce the risk of developing the first sign of complications.
Right now, there is no complications. I'm managing it, exercising.
Virgil admits there have been challenges along the way, but with a little help from his wife and a determination to properly manage his diabetes, he's seeing results.
When I really got serious with my diabetes, maybe 4 or 5 years ago, I started to see a trend with the weight down, and especially when I moved to a new medication, I was able to really keep my weight down.
You don't have to lose very much weight to have a very big impact on your blood sugar. A weight loss of as little as 5% can reduce your blood sugar substantially. So we usually say that a weight loss of 5 to 10% can reduce your A1C by somewhere between 0.5 and 1, which is just like taking another medication.
And while the diagnosis of type 2 diabetes can come as a shock, controlling type 2 in many cases is in the hands of the patients and not the doctors.
Once you know you have type 2 diabetes, you can do a lot yourself to make it much better.
Fortunately for people with type 2 diabetes, a combination of lifestyle changes and a variety of effective medications can give them power over the disease and the chance for a healthy future. It's important to emphasize that they are in control and not the diabetes. To answer any specific questions you may have, be sure to contact your healthcare provider.